of the slides indicated, does include several ways to address tort reform. Now, you can look at different studies. I understand that may be looking at different sources of data to make their point. But the generally accepted studies say about 4% of healthcare costs are due to medical malpractice. Now, let's remember what that is. It's something that's gone wrong. It is a bad outcome. It is an injury. It's a mistake that was made. Now, what you can't do in looking at this is assume that nothing has been done to address this. Before I was elected to the state legislature, it would have been in '95, the state of Michigan passed very aggressive tort reform. In fact, the Michigan State Medical Society, that represents doctors, hailed it as a huge victory. There were caps on damages, caps that people could receive through a lawsuit that actually weren't adjusted for inflation, so the same caps that happened in 1995. And I think 36 other states have those same kind of laws. Further, in Michigan, there is something called an affidavit of merit, where a specialist has to look at the facts in a case to determine whether it's worthy to bring it forward. So there are a number of things that exist all over the country. What this bill does is try to, it actually offers incentives to states to adopt them. It's called a certificate of merit rather than what we have, affidavit of merit. It encourages states to adopt those certificate of merits to weed out frivolous lawsuits. It actually offers incentives for something called an early offer, kind of an alternative dispute resolution approach. And for community health centers, which are providing a lot of safety net, really good primary care in communities, those doctors have a different level of liability protection, more immunity, and the bill also allows volunteer physicians, that dentists and so forth, that provide primary care in the community, to have that same kind of immunity. So to say the bill doesn't address tort reform is just factually not correct.